Some public figures have suggested a direct causal link between Tylenol use in pregnancy and autism. So from your perspective, is that accurate?
There was a small study that showed an association between Tylenol use and rates of autism. But association does not mean causation. It showed an association that the women who had a higher level of acetaminophen had a higher risk of having a child with autism spectrum disorder. It was a small study. It was an association. They did a bigger study, and it was actually a twin study, where they were able to confound for factors like genetics, exposures, chemicals. And that larger study did not find an association. So does Tylenol cause it? No. Can Tylenol play a role in it? It's not impossible. So the advice to women who are pregnant is always try to avoid medication. Any medication during pregnancy can cause problem. We just don't know. Best to avoid all medications, but more important to treat your fever. If you have a fever, a high fever is more dangerous to your baby than anything else. High fever at any point during the pregnancy, even worse in the second or third trimester, can be associated with developmental delay or any kind of fetal demise. So you want to treat a fever. And as a pregnant woman, there's not a lot of choices. They cannot use non-steroidal medications like ibuprofen or Advil. Those have been proven to cause harm to the fetus. They should not use aspirin or any of those. So what does a woman do who has fever? Treat the fever. Try to take the lowest doses of acetaminophen as possible.
And for parents, and especially now for expectant mothers listening, what's the bottom line on this specific medicine, especially what should they really take away from this conversation?
For now, the best choice we have.
Hello and welcome back to the Best Life Code with Dr. Rudy. Dr. Rudy, how are you?
I'm doing great, Vivek. How about you?
Great as well. But today's topic is complex
And heavy.
and heavy. That's true. There's a lot of buzz around it, but I think this show goes to a lot of people, and people want to hear from their trusted resource. So they definitely want to hear your point of view on this. So we are going to talk about straight up today the everything about Tylenol and autism, especially in pregnancy, and that's the big hype. So if you're ready, I'm ready to jump into this discussion today.
Let's go. And that's a subject that at first, Vivek, we were saying, should we talk about this? Because it's very political and we try to stay away from politics. But it is a public health subject. And it is something that in my practice, I've received a lot of calls because I am also the medical director of a Native American clinic. And we're getting a lot of calls on women either pregnant, what they should do, or if they had a child with autism, they said, did I cause that to my child? So the statement that was made created a lot of confusion. So let's get going.
Yes, so of course, some public figures have suggested a direct causal link between Tylenol use in pregnancy and autism. So from your perspective, is that accurate?
A short answer is no, but it's way more complex than this. Like everything in medicine, there's no short answers. And the fact that we have public figures who come up with a statement that Tylenol causes autism, period, causes more harm than good. Nothing in medicine is that simple. It tends to be multifactorial. So let's unpack a lot of this, right? So Tylenol, which is acetaminophen, it's one of the most used drugs throughout the world. You know, I grew up in Haiti. My wife is from Jamaica. We use a lot of paracetamol. This is Tylenol. This is acetaminophen. So the statement that was made was that Tylenol causes autism. Women, please do not use Tylenol while you're pregnant. So let's keep going deep on this, right? And to give credit, I'm not going to say that this statement was made by, the government without any studies, because there was a small study that showed an association between Tylenol use and rates of autism. But association does not mean causation. And that's just sometimes a difficult sentence for a non-clinical person to understand. So there was one small study that showed, and they even looked at the level of acetaminophen in cord blood. So it was a good study that showed, and it showed that it showed an association that the women who had a higher level of acetaminophen had a higher risk of having a child with autism spectrum disorder. It was a small study. It was an association. They did a bigger study, and it was actually a twin study where they were able to confound for factors like genetics, exposures, chemicals, and that larger study did not find an association. So if you're going to nitpick, somebody can say, but there was a study. Yes, there was. But a later study that was better made, had more patients, and had a bigger way of predicting outcomes did not see that association. But because that one study was there, people can just point the finger, but they don't know what came after. And since that study, there's been a lot more studies that cannot pinpoint the causes of autism to one thing. One thing I can say, because the question I always get, are we really seeing an increase in the incidence of autism? Because the latest CDC numbers show that 1 in 31 children in the United States, 1 in 31, that's a high number, is going to be diagnosed with ASD. When I was growing up in the 80s and 90s, in Haiti, we didn't see it that much. Even in the States, when we came to school here, we didn't see that much. So some experts will tell you that the incidence didn't really change. It's just that we diagnose children at an early age. And because we diagnose them also at early stages, that now they said that those children always were there. They were never diagnosed to be within the spectrum. Well, most studies that I see, and I can see it personally, and I think most people listening, they can tell you, no, we are seeing more kids, more children with neurodivergence. Again, what neurodivergence is just that they are not wired in the brain the same as the typical neurotypical versus neurodivergent. And now that spectrum of ASD is wide. Can it be hypersensitivity syndrome? Can it be social issues? Can it be um, different sensitivities? Can it be more of a developmental delay? And when you talk to parents, they'll know that something is not the norm in their child, is not typical. That's the spectrum. Where do we diagnose a child with ASD? It's There's a lot of criteria to be in that ASD spectrum, but a parent will tell you, I know that my child is not neurotypical. And neurodivergence is something that I'm learning how to understand more. We need to embrace that it's here. We have those children that are coming up with that neurodivergence. We need to embrace it. We may not know the cause, but we can help them. And we can even put children like this, and when they become adults, in position where they thrive. It's not just helping them, they can help us. One of my best friend's daughter, she's 21 years old now. She was diagnosed with ASD and different things. And it's been an honor and a pleasure for me to be part of the treatment team that helps her. She's improving, definitely thriving. There's a lot more treatment. But I even had the conversation with the mom when that statement came out. And she's like, I did take Tylenol during my pregnancy. Did I cause that? How horrible is it for a mother to think that? Again, we need to stay away from oversimplifying medical complex issues. Like everything in medicine, it is multifactorial. Does Tylenol cause it? No. Can Tylenol play a role in it? It's not impossible. So the advice to women who are pregnant is always try to avoid medication, all medications. But at the same time, you need to treat a high fever because the problem is high fever at any point during the pregnancy, even worse in the second or third trimester, can be associated with developmental delay or any kind of fetal demise. So you want to treat a fever. And as a pregnant woman, there's not a lot of choices. They cannot use non-steroidal medications like ibuprofen or Advil. Those have been proven to be harm to cause harm to the fetus. They should not use aspirin or any of those. So what does a woman do who has fever? Treat the fever, try to take the lowest doses of acetaminophen as possible, and don't feel guilty.
What's the biological mechanism that makes, even to consider this as a possible link? What happens?
Yeah, so what's interesting with Tylenol is that Tylenol is can be a dangerous drug. when I was doing hospital medicine, I've admitted quite a few patients who had acute liver toxicity with over-the-counter Tylenol. People who weren't taking even that high of a dose, and they developed this. Tylenol depletes glutathione. Glutathione is a master antioxidant in the body. So by depleting that, if you take too much Tylenol, your body no longer can it has the antioxidant reserve, and you can go into shock. You can go into liver failure. You can go in liver dysfunction. If you combine that with alcohol, even worse. So the mechanism of action, even for brain development, is that by reducing the levels of glutathione, you increase oxidative stress in the body. You increase inflammation. Basically, I want people to think about glutathione, antioxidant, it decreases inflammation. Our body creates oxidation. We need antioxidants, things like glutathione, to maintain the level of inflammation versus non-inflammation. So acetaminophen is a really good fever reducer, really good, but it depletes your glutathione. So that's the mechanism of action.
Yep.
One of the main mechanisms of.
And this is for the non-clinical people like me. If you ever hear the or see the advertisement on TV, they do mention about this the damage to liver or precautionary thing, the side effects in
Yeah.
in and they will say it really quickly how they say
Very quickly, be careful.
but they say it. And if this is just for everyone, if you see the Tylenol ad next time, you will hear it.
Yeah.
Um, but
A couple of other points I wanted to make. For example, in those statements, they said that in Cuba, they don't have any cases of autism. And I have the pleasure and honor of working with a nurse practitioner who was a physician in Cuba and who said that is absolutely not true. They have cases of autism. They do use paracetamol. It is the most common fever reducer medication almost all over the world. And there are cases. Now, if you look again at the estimates, it is estimated that 1 in 31 children in the US are diagnosed with ASD. Within the world, it's about 1 in 100. But again, why that difference? Could it be because in different countries, we don't screen as much? It's not, it's not, right? In Haiti, we don't diagnose people with autism because we just don't have the capabilities. In India, I'm sure they have the capabilities, but maybe you go to the villages, nobody gets a medical care, a medical exam. So, what is the true incidence? It's difficult to know. But I have to say, I've seen an increase in my friends, in my patients. A lot more people are reporting that their child was diagnosed with ASD. And something interesting is that it's 3 times more common in boys. Why does it affect boys more than girls? Again, we don't have the answer. We have to think that there's an interplay of genetics and environment.
how
And
much
we have to think. Go ahead.
how much do you think, like, we did have a black swan event like COVID, and I can speak from my personal experience. My baby was born at that time, and we ran into this period where her speech was delayed, right? And we were obviously, in being in US, also we were told that, hey, watch out, maybe she's on spectrum. So and so I guess my question is, I know we saw this study. How old was the study that the government is referring to? Because we did have events like COVID, which never happened for many, many years. And then all of a sudden, there's a whole generation was born at that time. And could we see that skew because of that?
Yeah, so the study that the government said that showed the association about 10 to 15 years old, the larger study, the twin study that showed that there was no association, I think was done in 2021. But what you just described here, Vivek, and thank you for being so vulnerable in talking about this. So many parents are going through this. The child did not meet the developmental milestones. And you're like, oh my God, is it the spectrum? Is it ASD? There are so many things that it could be, right? And it's so anxiety inducing into the parent. But the right thing to do whenever you see as a parent, you see something that you're like, go and see a medical professional. Because the earlier, whether we put a label or it or not, for example, I have a friend of mine whose child was diagnosed with ASD at 4 years old. He noticed the signs since the kid was one. He delayed because he was in denial. Finally, when at 4 he went, again, it met the criteria to be on ASD, but what that allowed him is to get a lot more physical therapy, occupational therapy, behavioral therapy. And because of that, the kid just graduated honors college and he's going to go, he has a big job. He's going to work in tech. So the diagnosis of ASD he had at 4 years old, because of the early intervention, can I say he was cured for ASD, quote unquote? We can say that, but he has a completely normal life, and we can say that he's neurotypical. Is there still some neurodivergence? It's possible. But for anybody listening, and again, thank you for sharing your story. If you see something is not right, get care. Don't let the medical community also gaslight you, because that happens a lot. Don't be afraid of a label. Even if they say there's a diagnosis, don't get stuck on words. As a parent, I'm telling everybody this: seek treatment, seek nutritional treatment, avoidance of exposure, behavioral therapy. All of those things help. And most kids will respond to this. At the same time, there is a fringe industry that is developing that is preying on parents who have this and will sell snake oil, right? The new snake oil, any kind of treatment for any kind of money because the parents are completely overwhelmed. So it's very confusing times. But the one thing we can say, those simplistic statements that Tylenol causes autism, period, have shown even more confusion in the public.
I do agree with this point that go and if you pick a signal, definitely find care, go to the specialist. And I'll tell you, that was COVID time, when our girl turned 16 months, 15 months, and it was hard to even find care because it was COVID time. But we did do those 16 session of OT, PT, even speech. And of course, this is New York, so had to pay out of pocket all that stuff. But the best 16 session we have done, and that
Yeah,
accelerated everything back, put everything
yeah,
back on track, right? Like, and that's it, right? Once for all.
yeah.
So
So now let me ask you, did they say she's quote unquote on the spectrum or did they say she's fine?
she, after that, she was cleared. It was just like,
Yeah,
oh, we don't know, might be initially, but then as you go, it was just speech. But then, once we did all the sessions
yeah.
for 4 months, everything just, she was the most talkative person there,
Amazing.
right?
What an amazing story that you shared here, right? And this is what's important is get early intervention. Unfortunately, you were lucky enough that you were able to pay for it out of pocket. Some people may not be that lucky. Some people may live in a country where that's not even available. Now you can get a lot of this on YouTube. You can get a lot of this there, but early intervention is key. And having the label. So I'm sure when at 4 months before, when they say she may have ASD, it is very anxiety inducing, but I encourage every parent, once you have this, forget the noise. Focus on treating your child and giving your child all the chances because there's a lot of things that can be done: nutritional, supplement, behavioral, speech and physical therapy. And then they're out of the quote unquote spectrum.
And I know you mentioned about Cuba, which we question the data, but in general, across the world, there must be still data related to autism, right? Globally, and paracetamol is everywhere, right? It's it's like worldwide medicine, treats fever and pain. So, do we see any kind of data that support that the idea of this is like somewhat even related, if at all it is,
Yeah,
across
no,
outside of the
no,
US?
we don't, and that's the point we were talking about before doing this podcast. Is paracetamol, which is acetaminophen. It is the most common used fever reducer in the world. In Haiti, they sell that in the streets. They put it in all kinds of things. It's everybody's taking it. If there was a direct correlation, like it was mentioned, we would have seen a high increase all over the world, whether there's early screening or not. We're not seeing that. Again, the numbers are showing in the world the 1 in 100 versus 1 in 31 in the US. And here's another point I want to make. I don't want to also minimize that we are seeing an issue. I also have a problem with scientists who say, oh, it's just a genetic disease. There's nothing we can do about this. That I don't agree. And the data does not support that. Because if it was just a genetic disease, why have we seen such an increase? And there is an increase in incidence over the past 40, 50 years. Why are we seeing such, and if we're asking that question, why are we seeing such an increase in metabolic disease, in cancer, in infertility, in endocrine disruption, in all those diseases we always talk about? There's no question that in the world, in the US more, let's talk about the US, we've seen an increase in almost every form of chronic disease, whether it be metabolic, neurodevelopmental, cancer, everything. What's happened over the past 40, 50 years? Our genes didn't change, our environment did. And here again, I come up with the concept of exposome. When you think about what we've been exposed to compared to how people were exposed to 100 years ago, completely different. Plastics. Now, studies show that 100% of the subjects that they tested have plastics in them. The estimates, whether they are true or not, they say that we have a plastic spoon worth of plastic in our brain, that we consume the equivalent of a credit card of plastic in a monthly basis. We can't avoid plastic. Pesticides like glyphosate, flame retardants like the PUFAs, all of this, we are bombarded by chemicals. So if you look at, we're exposed to all this at all time and everywhere from the time we were in the womb until now. If somebody develops autism, how can you tease out one thing that caused it? If somebody develops cancer, you're going to say what caused it. You are exposed to thousands, if not hundreds of thousands of chemicals during your exposome. It's hard to tease whatever causes one thing. That's why most causes of disease are multifactorial, and environmental causes are playing a big role. And to talk about genetics, people need to understand that genetics and epigenetics are different. Genetics are your genes. You are born with your genes, they never change. But what gets expressed, it's your epigenetics, meaning that the environment decides which ones of your gene gets expressed. So for example, very simple, BRCA, BRCA is the gene for breast cancer. If a woman is positive for BRCA gene, it doesn't mean 100% that this woman is going to develop breast cancer. She has a high risk. There are some environmental cues that increase that risk of developing it. That's the epigenetic. And environmental factors play a big role in epigenetics. So the data is showing that the cause of autism, like the cause of many chronic disease, is multifactorial, including genetics, epigenetic, social, economical, social, environmental. And the biggest things, I'm going to keep saying that has happened over the past 40, 50 years, our environmental is much more toxic. We're being exposed to millions of chemicals, constant exposure to electromagnetic fields, constant exposure to hormones, pesticides, endocrine disrupting chemicals. When you think about the number of exposure we get to, no wonder we see such increase in disease in our society.
And this is probably true in some of the other diseases we are seeing it too, right? Um, I was reading the study that uh, higher risk of Parkinson's, Alzheimer's when you are next to a golf course. And that's because there's a lot of pesticides and environmental issues existing that. So now over time, people who are living there in that population in those areas, you see a little rise in numbers. And
Yeah,
now that explains the problem of exposomes that's going there in
completely.
in different disease, but we can see that.
Different disease. Let's take the example that we talk a lot also, low testosterone in male infertility. How come over the past 40 years, proven by studies, we've seen a 52% decrease in sperm count? How come we've seen such a big decrease in testosterone levels over the past 40 years? Well, Dr. Shanna Swan, in her book, Countdown, was able to point directly that the decrease in sperm count is related to some plastic use, specifically phthalates. Phthalates is a part of plastic that makes plastic pliable, and that is called the phthalate syndrome. And she showed that um, baby boys who were exposed to high levels of plastic during the first trimester had a higher risk of developing fertility problems and testosterone and sexual issues, even testicular cancer. So she was able to point directly to that plastic. But it's a difficult study to do. You have to do it years and be able to tease out things, and you have to know the mechanism of action. And you're not exposed to just one thing, right? It's not, you cannot do an experiment where you expose a baby to just plastic and you see what happens 30 years later. That we can't do this because they're exposed to everything. We are all exposed to everything. So when you look at the amount of the increase in incidence in varied diseases, we have to say that the environment is playing a role via the epigenetic expression of our genes.
And you shared in our conversation the ice cream and the polio story as an example.
Yeah.
Can you explain how that 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 will help understand the difference between correlation and causation here?
Yeah, so that's something that's really important. So this was back in the 1950s, mid 20th century, where polio was really high incidence of polio, and they were trying to find out what causes polio. How can we avoid that? And polio has really high morbidity and mortality. So at one point, polio, like there was a public announcement that was made that it said ice cream or sharing ice cream may cause polio. Don't share ice cream, don't eat ice cream. Why? Because polio tends to have higher incidence during the summer months, June to August. That's when people, because it's usually transmitted person to person. During the winter months, people are away from each other, it doesn't get transmitted as easy. So during the summer months, June to August, you have a higher incidence of polio. During the summer months, kids drink more ice cream. So the correlation was made that, ooh, kids more have more ice cream and there's a high incidence of polio, then it's possible that ice cream causes polio. And there was public service announcements made at that time, be careful with ice cream, be careful with sharing ice cream because it may cause polio. There was a correlation, not a causation. So we are possibly going the same thing with Tylenol and autism. There was a study that showed a correlation, but later studies are showing that it is more complex than this. It is not the only thing. But again, we're going to reiterate that. That doesn't mean for women, take Tylenol as much as you want while you're pregnant. It still means avoid any medication while you're pregnant, but make sure that you treat your fever. And for now, until we come up with a better medication, acetaminophen remains the best fever reducer. And for a woman who's considering this, to take it at the lowest dose that will reduce your fever. And make sure you contact your gynecologist, your OB, and you discuss that. And another thing very important, for any woman, any family who has a child that was diagnosed with autism spectrum disorder, remove the guilt. You did not cause it. This statement has made a lot of people think that their actions caused their child to have this. Remove the guilt. To me, that's the most important healing thought I can send out there. You did not cause that.
And for parents, and especially now for expectant mothers listening, what's the bottom line on this specific medicine? Especially, what should they really take away from this conversation?
What I just said, Vivek. And again, let's repeat it. A high fever is more dangerous to your baby than anything else. If you have a fever, you need to talk to your doctor and take Tylenol, acetaminophen at the lowest dose. If you can avoid any medication, that's the best thing. We know that. But you should treat your fever, you should treat your symptoms. But don't take it lightly, because I do see also that women may think, again, women, again, the women are the ones carrying the baby. I don't want a woman coming out of this and she's pregnant and you have a little back pain, let me take some Tylenol. No, we need to be careful. Then we need to send the message. Any medication during pregnancy can cause problem. We just don't know. Best to avoid all medications, but more important to treat your fever. If you have a fever, for now, the best choice we have is acetaminophen, and you want to start at the lowest dose possible, and you consult with your own physician.
All right. So I think this is the core message today. Um, of course, that announcement came, but we cannot also just negate it that this was without any study. There was a study, there is some, but it's not conclusive enough to pinpoint one thing here. And like you said, if you can avoid medicine, you should. And that shouldn't be the reason to just take it. And you should not avoid it. If it's fever, then definitely consult your physician or the care team that's helping you out. So,
Exactly.
very
Well
important
said.
message. Very important message. And again, one thing again, I want to reiterate to everyone, for especially the families who have kids with autism, this is not the time to blame yourself for any of these. Again, this is very inconclusive still. So remove the guilt. How Dr. Rudy said, that is the biggest biggest healing power you will give to yourself, and and that's the right message. To be honest, this is again, as a non-clinical person, I would tell the same thing and take your advice and spread this message. That's what it is. So good to hear from you on that.
Yeah, it's very good. And again, Vivek, thank you for sharing your story. That was a very personal story, but there's millions of people going through this. So I hope somebody get that and be like, okay, if that happens to me, this is how I would handle it. Go see your provider. Even if your child gets labeled, you don't stop there. Get the early intervention. You will get a lot of help with this.
Yeah, we are a big advocate of this because we saw this and we were able to mitigate the problems that we had. And that's why, even to our friends, and we've seen it with some friends who are not accepting the fact sometimes,
Mhm.
and we try to tell them this story from our end, like this is exactly happened to us, and that has helped few people in that way. That's why I share this story very openly, because I know it will, somebody will listen and that will be helpful to them, right? So that's what it is. So
So
pleasure.
before we finish, I want to add one more thing. Again, this is no longer about Tylenol and autism. This is just about autism. And one of my favorite subjects, psilocybin, magic mushroom. There's a lot of studies showing that microdosing psilocybin helps the neurodivergent brain, helps children with autism spectrum disorder. In states where it's been decriminalized, we're seeing a lot of help. And I'm going to tell you again, the friend that I have that has his daughter with autism, she's now 21. They moved to Colorado from Florida because they are able to use psilocybin microdosing. The changes I've seen on that child with the microdose of psilocybin are amazing. So there is a lot of help between the early intervention, the nutritional things that you can do, the behavioral intervention, and there's more coming in the horizon. So any parent listening to this who has a child dealing with ASD, keep an open mind. Talk to different providers and look into this because I've seen it. I've reviewed the studies and I was intrigued because, I talk a lot about psilocybin and psychedelics for neuroplasticity, rewiring of the brain, new connections in the brain. I use it for anti-aging, for depression. Um, but to see the studies on ASD, I was very intrigued. And then once I had the personal experience of my friend's daughter having this, I was like, wow, there is something to this. So anybody listening, keep an open mind. I'm not saying to go and use something that is not legal in your state, but there's a lot of states where it's now legal or at least decriminalized.
All right. Well, on that note, we will end today's episode. Very heavy conversation, but it's an important topic. We had to talk. And like I said, people are expecting to also hear from Dr. Rudy's point of view and share his wisdom. So thanks for, again, taking the time and providing your insights on this topic. Thanks again.
Thank you, Vivek. Till the next one.